Good evening. My name is Kennedy Patterson, and on today I'll be presenting an informational speech on the severity of thyroid cancer in the United States. Thyroid cancer in the United States is known to be a rare disease, yet and still we have a very high number of cases of thyroid cancer. Thyroid cancer affects all genders, but specifically it is more effective to women. I believe with the information presented in my speech, we can not only prepare but prevent the thyroid cancer. What is the disease? Thyroid cancer is a cancer that grows in the thyroid glands. It is caused when cells begin to mutate. Once they mutate, they multiply and grow into take over the thyroid gland. Thyroid cancer is about the size of an average person's hand. Yet, in very severe cases, it can grow to be from the size of a golf ball to the size of a softball. There are four types of thyroid cancer. There is papillary, medullary, anaplastic, and follicular. Now, out of the four types, papillary is the most rare, but it is also the most common in women. Who does it affect? Papillary affects women the most. Yes, it affects women between the ages of 20 to 60s. The highest peak is in the mid 40s until the late 60s. Yet and still, it is still curable and treatable. Theories of how the cancer got started. People, along with scientists and doctors, believe that all their cases come from a radioactivity. As doctors have seen, all of their cases have some type of radioactivity once they run scans. Scientists believe that the theories of where they came from are from nuclear power plants, radioactivity, iodines in the thyroid glands, radiation therapy from a severe injury, normally dealing with the head to the neck, and food contamination by radioactivity. Now, with the nuclear plants, they believe that you either worked in one or you live very close to one, or in severe cases where a nuclear plant somehow exploded, it expanded all the way to the range of your home. How to be prepared. The best way that scientists have believed to prepare for thyroid cancer is to get tested. Now, it is very often hard to diagnose it, but it is not that hard to detect it. They believe with the constant check, normally from men and women annually checkup or every 6 month checkup, that you can detect the thyroid cancer before it gets out of hand. Now, with that being said, you have to ask your doctor when doing the checkup to run a thyroid cancer checkup because they have certain points on their list to check off, and thyroid cancer, with it being known as rare, is not always one of them. Symptoms and signs. There are no immediate symptoms of the thyroid cancer, but over time it does begin to show. Signs such as lumps develop, changes in voices, difficult to swallow, and pain from the neck to the throat are normally the first known signs of a thyroid cancer. Treatment options. Normally, people go for the surgery, being that they believe that it is head on and it gets rid of it. Despite what scientists have discovered, they believe it is not always the best option. But there are three types of surgery that people normally go for. The thyroid lobectomy, that is normally the removing of a piece of the thyroid gland. The thyroid also has a surgery known as the lymph nodes dissection. And last but not least, the thyroidectomy. Other treatment options are known as hormone therapy, external radiation therapy, and the well-known chemotherapy. In extreme cases, we have the target drug therapy and the injecting alcohol therapy. But those are only for very extreme cases, and doctors do not recommend those therapies. Many people that get the surgery also have the downfall of having to have repeated surgery due to the cancer not being able to be taken all out to assure that the people will not lose their thyroid glands, they do not get all of the cancer and it inevitably grows back. Helping one that lives with this cancer. There are cancer center treatments all around your local area. The most known societies with this cancer are the American Cancer Society, the American Thyroid Association, the Medline Plus, and the most known is the National Cancer Institution. These have branches in your local area or in the surrounding areas near your local area. The most important thing that doctors and also scientists believe helps patients get through the thyroid cancer is not the medicine, but the help of family and friends. Doctors believe that making their patient, and your family or friend comfortable is the best solution to this. Going through this time, they have very difficulty getting through and adjusting to their new normal that they have to consider their lives. Also, preparing them to adjust back to the real world can be a difficulty. Many also face depression and anxiety going out into the real world after being instituted into this cancer center. Every so often, they have to do 3 to 6 months follow up after the first surgery or after the treatment has been done. For a year, they have to do 3 to 6 follow ups. These constant checkups are why doctors and scientists believe that friends and family members should get involved and also get as much information as they can on this disease. Inevitably, everyone that is aware and is known of this disease can also help prevent it and keep the case numbers down, and also can be there to prevent the family from any more heartache. Thank you for listening.